I'm trying to focus. I'm trying to focus. Okay. Hey everybody, how are you? I'm doing pretty well. I just finished one of my block exams. Honestly, how many exams have I actually taken? The last 7 days of medical school, just not even of medical school, of last week, including today, Monday, have been crazy. I've literally had 4 exams, 4 exams and practicals in the last couple of days. I had my first standardized patient encounter last week. I had an exam about osteopathic manipulative medicine. I had an exam about, oh my gosh, not just the practical applications, but the written exam of that. So that's my 3rd one. And then today we had histology and our cell bio, and learning about cancers. And so I can't believe I've gotten this far because oh my gosh, yo, last week I only could have gotten it through. I only could have gotten through it with God. If I can tell you the amount of stuff that we had to know, hours and hours and hours of lectures and then techniques and a lot. So I'm gonna just briefly talk about what each exam was like the content of each exam. So for our patient care exam, which is the class I also had the standardized patient encounter with, we had to learn and describe and understand how to use empathy, looking at review of systems, what are the medical terminologies the medical terms that fall under each category. Also, why would you do something? Would you use open-ended questions at the beginning of your patient interview or at the end? And what do you do in the middle? And what are the types of things you have to make sure that you ask your patient? If they come in for joint pain, you ask them for when did it start, if anything relieves it, if they can remember if it radiates, is the pain radiating, is the pain feeling dull, is it chronic, is it acute? And so that was one whole thing. I didn't even realize there were so many words for things that I didn't think actually had words for, but there's terminology for leading questions and terminology for the bias you get when you don't remember the sequence of events. And then we also had to know how you get around that. So say someone is experiencing the halo effect. So basically they have really, really strong emotions or even opinions about some type of event. And so what a physician is supposed to do is ask them about previous events that have kind of shaped their view of a particular thing or opinion. So I'm getting notifications. So that was one class. Okay, and on top of that, you had to actually do it in person with a patient. Okay, great. So, well, not do it with a patient, but be able to apply your review of systems and everything, and you have to do that from memory. And so when I went in for my standardized patient, I just did everything from memory. I was just, spewing out the review of systems and making sure, I asked this and got their medical history. There's certain ways that you can ask specific questions when you're gauging someone's risk or occupation, or if you're asking them about their mom or father and maybe they've passed away, do you end up, when you're a student and when this is we're learning to be the best student doctors we can in hopes of actually becoming doctors. So you can't just say certain things or mislead or even just ask leading questions. So that was a whole exam and practical. And so then we had a OPP, which was learning about, oh my gosh, this was literally almost a week ago, but I know it. We learned about muscle energy. We learned about just the spinal cord and the lordosis and kyphosis of the different curvatures of the spine, vertebrae, and then we learned about myofascial release of the knee, balance ligament tension of the shoulder, and things like that. And so for the practical, we would go into the exam having to know all these things from memory. I want to say there was I don't know, just a little bit less than 20 things we had to know. We had to do an anterior, posterior, or a lateral review of someone, just like a screening to see, you know, if we knew where the glabella was, we knew where the mandible was, angle of mandible, things like that. And so that was the beginning of that exam, and then at the end we actually had to do the techniques, whether it was myofascial release or balance ligamus tension of the interosseous membrane between your ulna and radial radia. It was just a lot. It was a lot. So I was learning like physical stuff. For me, it's very interesting, and I have to like kind of assess different, I don't know, it's just I had to assess different parts of like how you position yourself, how you're positioning the patient. What are you actually doing? Are you moving away from the restriction, towards the restriction, towards the ease, into the ease? If your vertebrae facet is open, you're probably bent this way, and then there's rotation, side, there's just like so much. And so that was that, and then a lot of the application was the same on the written exam. So you just had to know what you wanted, what you were doing, why you were doing it, and how you're placing the patient and how you're placing yourself, kind of thing. Okay, so I just took you through 3 exams, and so my last exam was of histo and biology and like cancer, molecular techniques and things like that. And so that exam was today. That was a beast. We had to know not only the cancers, but the genes that were affected, whether they were tumor suppressors or oncogenes, and then you had to learn about the type of therapies and modalities to use to treat it. And so we were going through systemic radiation, we were going through EGFR, small molecule inhibitors, or the, what is it called? Wow, I literally just took this exam. Antibody, monoclonal antibodies. That's a type of inhibitor, and we had to know like these different names, like imatinib. Like it was just it was a lot. And then on top of that, we were looking at slides for histo. We were doing the central nervous system, peripheral nervous system. We had to know about the ganglia, what they look like. We were doing blood, we were doing neutrophils, we were doing, like, we had to pick these things out on the slide. You know, we had to look at the gap junctions, we had to look at the connexons, we had to know about the sarcolemma. We had a bunch of stuff, and we did nervous tissue, bone, and then the muscle. So cardiac muscle, smooth muscle, and skeletal muscle. And so I wouldn't say my brain is fried, but I hope from me explaining to you what was on each test and like the depth of how you need to know all these things, how, you know, for cancers, it's not just knowing how it should work, it's the mutated gene, and then you can't use certain drugs because it's not high up or it's too low on the mechanism scheme. Girl, boy, whatever you are right now, it's a lot. Medical school is a lot, and I don't want to deter anyone from going to medical school. I actually enjoy learning everything that we have to learn. It's not particularly hard. It's just there's so much to know. And I think for the beginning, if you've watched my videos, I talked about how I was really struggling with, I had the information, but just like compartmentalizing it and making sure I understood the learning objectives for each lesson is really what kind of got me. And so what I think is how I think my study method right now is, like, for histology, completely different than all the other classes. Like, I have to be looking at the slides closer to the test date. Like, I can't learn histo 3 weeks ago and then be able to apply it now. Like, I gotta do like a little more of a cram for histo, just because there's just minute little details and changes between different tissues and cells and stuff like that. So I need to have that fresh in my brain. But for the other classes, it's more application with the patient care, learning how to be the best student doctor class, as well as OPP. Like I literally just have to practice on my friends and my roommate and stuff like that. And then with my like cancer, molecular biochemistry class, that's really interesting because I can learn all the information, and if you ask me something, I got you, but it's just the organization. So then what I've realized is closer to my exam, I need to go over the exact learning objectives that the teacher wants us to know. So for instance, if we had to learn about, I don't know, tumor suppressors, I could tell you all the genes and everything associated, but if you ask me what's the difference between something that increases the expression of MYC, which is an oncogene, versus, you know, I don't know, the medication you would prescribe to someone, or the type of inhibitor you would prescribe to someone for a, I don't even know. I don't know, it's just different, and I can tell you it, but I need the overarching term, so kind of like the subheading or even just the heading of what we're learning. And so I've been really making it a point closer to the exam to go over that information and make sure I compartmentalize every different topic where it's supposed to go in my head, because it's a lot. You have so much information and you gotta like be able to put two and two together. And so today I'm really happy with my exam. I got stupid questions wrong, but that's always what happens. Sometimes there are reading errors, sometimes you're just like trying to finish really quick, but at the end of the day, I'm like very happy with how I've been getting through school. My exam grades and stuff like that, I haven't gotten my exam grades yet. So we'll see for these last like 4 exams and exam/practicals, we'll see what I actually got, but I'm very, I didn't fail, I didn't get a C, so like we're good. So yeah, that's about it. I don't know if I said this, but my name's Camille. Thanks so much for watching. I post videos about getting in, staying in, and even applying to medical school. So if that is of interest to you, feel free to like and subscribe to this video. I'm gonna be posting so much more. I'm gonna take you along my day today because like, yeah, I just had my exam and I just did like a brain dump talking to you guys of like everything I've been studying. So then like maybe 4 years from now, I can go back and be like, oh my God, I remember when I was learning about angiogenesis, like, oh my gosh. But anyways, with that being said, I won't bore you. Stay tuned for my next video. I will take you along a day of kind of de-stressing, but also getting back into the swing of things because I have an exam a week or so from now, and that's gonna have 3 subjects on it, not just 2. So with medical school, you can't slip, but you can take a break. All right, and with that being said, see you in the next video. Bye.